Hi, I will be talking about childhood dysarthria and assessment and intervention considerations. Who will I be talking about? I will be talking about children who have been diagnosed with dysarthria. What is dysarthria? Dysarthria is a group of motor speech disorders that impair the strength, steadiness, tone, speed, and movement of speech. Abnormalities may be located in the central and peripheral nervous system. It can impact respiration, phonation, articulation, resonance, and prosody, which are all necessary for speech. Some characteristics that someone with dysarthria may have are hyponasality and hypernasality. Hyponasality is when there is little sound resonating in the nose, and hypernasality is when there is too much sound in the nasal cavity. Other characteristics consist of speaking too fast or speaking too slow, and weak and unintelligible speech. Children may also struggle with sucking, chewing, and swallowing, and this can result in lots of drooling and choking. A child with dysarthria may have weakness in the coordination of muscles that they need to produce speech. Up here we have what the central nervous system and the peripheral nervous system look like. Types of dysarthria. There's flaccid dysarthria, which is weakness in muscles and a disorder of the lower motor neuron system. Spastic dysarthria is a bilateral disorder of the upper motor neurons resulting in rigidity. Ataxic dysarthria is in coordination of speech due to cerebellum damage. Hypokinetic dysarthria is problems in the basal ganglia and movement initiation. Hyperkinetic dysarthria is involuntary movement. Unilateral upper motor neuron is damage to the upper motor neurons that carry directions from the spinal cord to the speech muscles, so they can't speak. And mixed dysarthria is more than one type of dysarthria. When dysarthria may be developmental, which is when it happens before birth or at birth. It may be acquired, where it arises from the result of something else. It can arise from spina bifida, which is when a baby's spinal cord does not develop properly. Hydrocephalus, when there's too much cerebrospinal fluid in the brain. Fragile X syndrome, which is when there are mutations of the FMR1 chromosome. Down syndrome is when there's an extra copy of the 21st chromosome, and Prader-Willi syndrome, which is a deletion of the 15th, a part of the 15th chromosome. Where intervention can start anywhere from home to a clinic with a speech language pathologist or in a school as the child gets older. They should go through referral, screening, evaluation, and diagnosis. The main parts of assessment and intervention consist of case selection. Some important parts of case selection are eligibility, intelligibility, severity, pattern analysis, stimulability, causal correlates, and outside referrals. What is eligibility? Eligibility is how to tell if a child qualifies for treatment. Children whose academic performance is impacted by their speech disorders, such as dysarthria, may be eligible for service. The parents' desires may also be taken into consideration so they can get the best help for their child. Intelligibility. Intelligibility is how well someone can understand the child when they're speaking. Children who lack intelligibility have a greater chance of getting help. Intelligibility may be associated with what level they're at, how fast or slow the child speaks, and the errors they make. The way that intelligibility is measured are open set, which is when the SLP will write down what they hear, closed set, which is when the SLP will compare what they hear to others, and rating scale, which is when they assign a number based on ranking related to the severity. Ranking scale should not be used often and should be avoided if possible. Severity. Severity is the condition of the speech disorders. They're usually classified as mild, moderate, and severe. The reason these classifications are helpful is because if the child is diagnosed with a mild condition, they may need less help than a child with a severe condition, and it kind of shows like where the child stands and how much help they need. Pattern analysis. Pattern analysis is looking at the child's speech sounds and patterns and comparing them to where they should be at based on their age. Looking at errors in children's patterns may help with diagnosing and treating. There are a couple types of pattern analysis, such as place, manner, voicing analysis, and phonological pattern analysis. Place, manner, voicing analysis is when the SLP will look at errors using place, which is where the sound is being produced and coming from, manner, where the articulators are interacting, and voice, whether the vocal folds are vibrating and making sound or whether they're not vibrating and not making any sound. In the top corner, we have a voice, place, manner chart, which kind of shows which sounds are which. Phonological pattern analyses are a way to analyze children looking at features of their ears. Children develop very quickly depending on their age, and at certain ages, children should be learning new sounds. Looking at these patterns will show a SLP where the child is at, and if they're on target or if they're delayed for their age. Stimulability is how well the child succeeds in imitating a word that they misarticulated after being given an example on how to do it correctly. This shows that the child is able to acquire the sound and can do it with or without therapy. Causal correlates is looking at information during the assessment process, may help with the case selection. Family history of speech impairments may be part of the reason why they have one, or any medical conditions or previous injuries may also be a reasoning for their speech impairment. SLPs are not qualified to diagnose everything and must be prepared to reach out to other professionals to make an accurate diagnosis. This is also known as interprofessional communication. An example would be an SLP working with an audiologist or a dentist. Sometimes children can't hear, which it will impact how they hear themselves, so they don't speak properly, or they can't hear what's being told to them. So the SLP must talk with the audiologist to determine what to do next. Some other children may have issues with their teeth, and it's impacting the speech sounds that they make. So the SLP must talk with the dentist to figure out what they should do next. Approaches for treatments for children with dysarthria. Children who have been diagnosed with dysarthria should be seen by a speech-language pathologist. Children who have dysarthria should be practicing using slower speech movements, moving lips, tongue, and other muscles more, and saying the sounds they are making more clearly. Some goal attack strategies are the vertical approach, the horizontal approach, and the cyclical approach. For more severe cases, the vertical approach can be used when they start working on 1 or 2 phonemes only, and once they achieve those 2 phonemes, that they can start working on new phonemes and incorporating them into the set. For more mild cases, the horizontal approach could be used to work on multiple phonemes at once. This can result in the child acquiring more phonemes at a faster rate. The cyclical approach could be also a good option, as it sets an amount of time for the child to learn the phoneme and practice it for that allotted amount of time. Why did I choose this? I chose the topic of childhood dysarthria to present because I know that I want to work with children, but I also really want to work with ones who have trouble with speech sounds and speech sound disorders such as dysarthria and apraxia. There's something that sounds so rewarding about helping children be able to speak fluently and how happy it would make their parents to be able to understand them. I also talked about case selection and intervention considerations because those are things that before this class I didn't think much of. I didn't really know much about them, and I really never heard of them. I didn't really realize how much of a process there was to assessment, diagnosing, and treating. These chapters really stuck out to me this semester, and I'm so glad that I got to learn about them this year. Thank you. Oh, here are my sources.